Welcome to Dad's Got Dementia Situation Saturday. So today we're talking bed sores. Ooh, yuck. Well, actually, it's not going to be that gross, but we are going to talk about it today because my father got his first and we hope only bed sore. And we think it happened a few weeks ago when he was in the hospital and they kept him for an extended period of time, maybe 4 days or so. But whenever he goes, they like to keep him in the bed. So we feel like probably it was just way too much sitting for him. And so this bed sore emerged. Well, luckily for us, it was probably maybe about that size. And it was just a dark discoloration on his bum. But we noticed it before it turned into the hideous sores that we all hear about. He's never had one. I've never seen one. So we were just so thankful that we caught it. And we took him right away to his doctor and then just to make sure we knew what it was and what to do with it. But prior to that, we always keep him nice, clean, and dry, which also contributes, as we've learned, to bed sores and the worsening of those bed sores. So again, it only turned into a dark discoloration and we caught it. And some of the things that we use, so we probably go overboard. So we bought him EHOB, I think I'm saying that right, EHOB, and it's an air cushion that goes in his wheelchair. And we also bought him one that goes in his bed. So it's a longer one that goes in his bed. And basically it has these little holes all in it. And I'll show you a picture. And so it kind of distributes his weight and, gets the pressure off of those pressure spots and make sure that he's not getting any bed sores. So anyway, we use that. And we also continue to use our Balmex cream. It's a heavy, and I always call it butt paste because that's really what it is. It really coats really well so that if he is wet because he's incontinent, it will just simply run off and not cause any additional trauma to that area. So we use that. But also I went to a medical supply store. I told you we go overboard. So I went to a medical supply store and I got what was called Calazyme or Zyme, Z-I-M-E, Calazyme. And that was something that they said people have had great results with when treating bed sores. So we have been treating my dad's bed sore. It did not turn into any grossness that we often hear about. It really was discoloration of the skin. So we're still just making sure we keep him clean, dry, and he's getting up often because he's not moving around as much as he used to. So we have to make sure that we're getting him up and allowing him to stretch his feet, stretch out a little bit, walk a little bit, all throughout the day. So if you have a loved one and they do have bed sores or you see some discoloration, anything that looks different from the norm, I would take them to the doctor immediately. And we also, when we took him to the doctor, they assign someone to come out for home care for wound treatment. Now, again, it was only discoloration, but again, we go overboard, so we welcomed it. And so he is doing great, no issues, it's clearing up, no problem. But we're just so grateful that we just didn't overlook it. So if you see your loved one going through that, please take them to the doctor, get them treated, and pay attention to their cleanliness and then how long they're sitting in one spot. Try that EHOB thing. We just started using that just, so he can use it generally when he's sitting in either his wheelchair, his lounger, and then we have it in his bed. So Hope this tip helps you. Pass it on to someone who needs it. Try some of those creams regularly. He uses those creams every day. So try them regularly to keep them nice and dry. Well, until next time, we'll talk to you later on Situation Saturday.